And with that, we'll go into staff reports. Kathy McKay, give our COVID update. You may be able to handle that all by yourself today?
Oh, it's a challenge. I will try, Mr. Chair. Good morning, Mr. Chair and Commissioners. I did give you the handout, and I believe Commissioner Haney should have received that now from Colleen. She was going to forward that on. And it shows our Clay County positive cases. This was as of 11/16, is 3,841. That's in our Clay County. We have 50 deaths, so there's a few more than the last report. And our 14-day case rate per 10,000 people, again, that's the number we use with the K-12 schools, and it's 123.41. That's continues to rise as our numbers rise. So, you know, it's higher than we'd like to see, but that's the reality of what's going on in our communities right now. Minnesota has a positive case of 231 total cases, 231,018, 2,900 deaths, and they have a cumulative positive rate of 6.3%. On the back page of this, or on the second to the last page, I guess, we have Cass County numbers as well. They have 13,581 cases, 1,562 active cases right now, 105 deaths. They have a cumulative positivity rate of 18.79. For some reason, they did not have their 14-day case rate, so when I checked with the North Dakota Department of Health, they did not have that rate for this week. So that's usually what we compare their 14-day case rate with ours. So our numbers are rising, as you can see, numbers of cases. We have, you know, from November 11th, we had 3,839 total confirmed cases by date of testing. So our active cases right now are 847. We're still doing the contact tracing case investigation with Minnesota Department of Health. They have hired a number of additional people to do contact tracing and case investigation because there was really a backlog for a little bit. And we have hired 3 more in the last couple weeks to provide contact tracing and case investigation in Clay County, so we can cover a lot more of those cases. Those are variable hour individuals, so a lot of professors and other professionals that are doing that beyond their regular work. You can see the age range. The highest is, of course, that 20 to 24 range. And then we've got, you know, there's a fair number of 15 to 19-year-olds, and then the 25 to 34. So those seem to be our highest ranges that are being affected at this time.
I suppose that's pretty much the people that are out working and our students, huh?
Correct, yes. The community spread is what we're really seeing when we're working with the K-12 superintendents and the higher ed. It's really they're seeing their students and their staff really acquiring the infection in the community versus in their classrooms. So they are working, we're following the numbers, and I'm sending the community numbers weekly. I'm also providing information for them to make decisions on what their plans are. We just worked with some of the higher ed this week to determine what that will look like for them. They not only look at the community numbers, but they also look at what's happening in their facilities, like the K-12 schools are really looking at what is going on in their school system. So the districts are looking at what their plans might be. I think Moorhead has made a decision about their distance learning. The other schools will certainly be making more decisions, especially with Thanksgiving and Christmas coming up, where they expect that there will be more spread, and we do too, as people go to their homes and have their gatherings. The governor just last week or the beginning of this week in their press conference now has decided that Thanksgiving gatherings should not be up to 3 households getting together. That was initially what they thought, small groups, but maybe up to 3 households, and they're dialing that back now. So they're really concerned about the growing numbers and the number of hospitalizations across the state of Minnesota, and of course with Sanford and Essentia. So they're dialing back to immediate households only. So that's their recommendation. It's not a mandate, but people need to adhere to some of those recommendations, especially if you have high-risk individuals in your families, because they're the ones that are concerning.
So you want us to choose between our kids from now on, huh?
Yes.
Which one should come? Okay.
Would you like some of mine?
Decide who you're going to gather with. You know, the difficulty, of course, with Thanksgiving is, you know, you're eating, so you can't have masks on while you're eating.
No, I
and
understand.
you're talking, and maybe you're hollering at your family. That's even worse as you spread the virus. So the numbers are concerning enough where they're just kind of recommending to people that let's dial that back a little bit. So that's the current recommendation.
It's very serious, yes.
Yeah, it is serious, right. So the hospitalizations across Minnesota, they're way over the 90% hospitalization rate. I've been attempting for the last couple weeks to get the hospitalization rates, the percentage at Sanford and Essentia. I haven't received anything, but I understand their percentages are high as well.
Well, okay, I think let's stop there, because I think that's the most important thing that is one of the most concerning out of all of it, is that what is the hospital capacity and what is the ventilator capacity. It's no secret that they are nearing capacity.
Right.
They're no longer taking transfers from certain cases within North Dakota. So I think that the public really needs to, if there's anything that's a major shift specifically for me, is that we have almost as many active cases in Fargo and Moorhead right now as we have no longer needing isolation from this entire time in Clay County.
Right.
And if we are nearing a point where we have no beds, that's vitally important for people to know.
Right, and we will get that information out on the website. They don't have it on any of their sites, and North Dakota Department of Health doesn't have it on their site. They have generally the hospitals across the state of North Dakota, but they don't have specifics. I talked with our Minnesota Department of Health epidemiologist to see, and they no longer can cite specific hospitalizations and numbers of Clay County residents. I just got that this morning, so he can't specifically give me. That's a decision that the State Emergency Operations Center has made. So we have a meeting tomorrow with Sanford and Essentia. So, you know, we hope to get some information from them. They aren't posting a lot of that, and I haven't been able to receive that from the North Dakota Department of Health. So, unfortunately, I've been making many attempts to get the information.
Well, and I don't, and that's not being critical of you, Kathy.
Sure.
I think it's because Sanford is doing what they can to deal with the onslaught of cases that they're
Right.
dealing with. And so I think they have far more important things than to get a certain number out.
Right.
What I'm saying is the public that's watching this needs to know that we're at a critical level with the availability for you to get into a hospital if you do need it. And that's scary.
Yeah, and I think that Sanford has also, and they've also had an expansion, or will have expansion of beds to their Broadway site. However, its staffing is still an issue. They have a lot of individuals, again, affected by COVID or quarantining, so there's a number of situations where they're really short-staffed, so they're trying to hire as many staff as they can, particularly nursing staff is at a shortage. So they're really trying to get more nursing staff, and they've put the message out that they're really trying to hire more. So,
and then I just have one more thing, and I'll let you finish your report.
Sure.
I had asked you late last week about the triage that had been set up at the Fargo Dome, the beds for the onslaught of cases because of COVID. That was taken down early into this.
Yeah.
And I'd asked if there were plans to put that back up. And you told me no, because there is not staff capacity to do so.
Right.
And that's something that I've heard in the community, people saying, well, why don't they do that at the Fargo Dome? Our health workers are so strained because of the amount of cases. We can't do that. And
Right.
people need to know this.
Right, yes. And that's a fact. It's not like that they would never put that site up, but it is such a large operation to set up a field hospital setting. It is, just like Commissioner Mojo mentioned, it's the staffing. They have to have people if they're going to set up the site, and they took it down. So to ramp that back up with all of the supplies and beds, et cetera, is a huge undertaking. So it isn't that they would never do it, it's just not currently right now. That's the plan. They still have beds on their north campus, so hopefully they'll, I'll learn more, and we'll post the information that we can provide on our website and on our Facebook posting. So we'll get more information at our Red River Valley Task Force meeting, which is tomorrow, and Sanford and Essentia have representatives on that group, so we'll get more information from them. I wanted to let you know about the vault testing. So we still have that site in Moorhead, semi-permanent site, and the last, so it's been going since middle of October. So our last week of November 8th, we've tested 4,032 tests. 2,200 of those were our Minnesota residents, and 1,800 were other residents, mostly North Dakota. So the positivity rate, the number of positive results out of that 4,082 was 843. So that positivity rate is 21.09. So it's been running. The last week before that, it was 22. So the thing about that site is it's a really good option for people to get tested. There's no criteria. It's free to individuals. They'll take your insurance card and they can bill insurance, but there will be no bill to individuals. So, and the reason why they're trying to bill insurance is they can recoup some of the costs of having this site. So it's a really good access for people in our community. There's also a swab testing site in Fargo, so that's an option as well. Our saliva testing site, we understand people are getting results in a very quick, it's a quick process, and it seems like results are coming within 24 to 32 hours, so that's really good that we're getting those results quickly so people can either isolate if they're positive or not. So we're not sure how long this testing site will be here. We know it was slated through December, but we'll see as time goes on. It's just been a great resource for our community in getting those testing. You don't need I even was asked, do you need a physician order? You do not need a physician order. You can go, you can do a walk-in. They're pretty good about shifting people through, or you can do an appointment. They have appointments set up. They have increased their hours, so now they were like 3 days a week, and now they're Monday through Friday. So they've increased the days of the week, and they're also on Saturday and Sunday. So they've increased their capacity in that regard. So it's Monday through Friday. I was sure I had the time frame here, but I can't locate it right now. But Monday through Friday they're open, and we'll have that posted. It actually is posted on the website, and it's posted on our Facebook page as well. So it's going to be open 7 days a week. So there's a little more ability for people to access that site. So that's good. Before it was 5 days a week, I believe. So I apologize. I don't know where I put that number, but it will be posted so people have better access to that site. Something else that Minnesota Department of Health is doing is they started texting all of the people that are listed for case investigation or contact tracing. And the reason why they're doing a text message is because we're having a lot of people that don't answer their phones. They're worried about a scam, or they're just unsure about the number. So we're missing people in following up when they don't answer. We can leave messages, but we don't get callbacks as well. And the Minnesota Department of Health is experiencing the same thing. So they're hoping, this text messaging just started yesterday, so they are hoping that there will be a better response. So it's less time consuming for those of us that are following up with these cases to continually call them. So the text message will just say that the state or local public health department is trying to call you about important information. So on the text message, it won't say anything about a COVID test, so it'll be confidential in that regard. It's just saying that we're trying to reach you, so please answer this call, and it'll give you kind of the area that we have some new system for calling, for people calling in. So it'll give the number that they will receive when we are calling. So we're hoping that will improve the people that will answer their phones or respond, so we can do the follow-up, provide the education. It's hopefully going to be an effective system to get that text message. So Minnesota Department of Health is texting everyone, so we won't be doing that. But then when we call, hopefully they'll respond.
They're texting every positive case?
Yeah, they're texting every positive case. So, and then we'll be able to get also those contacts once we call them. So we're hoping to capture a few more of those cases that we're missing. There's a lot of cases that just will not return their calls and won't answer their phone. So we'll see how effective that is. I think a lot of people are doing the texting, so we think that's going to be an effective means so that they understand it's not a scam that they're getting a text message from. The other thing I can mention is our West Central region is working with a hospital in Fargo to set up an antibody therapy. It's an antibody infusion. They'll be getting the antibody infusion stuff from, it will be shipped to this facility in Fargo, but our West Central hospital system will be providing, they'll partner so Minnesota residents can also receive this antibody testing. Now, the FDA put out an emergency use authorization for this to permit this. It's a monoclonal antibody therapy. And so it's to help treat those mild to moderate COVID cases in adults and pediatrics. The pediatrics, you have to be at least the age of 12, however, to receive this, and you have to have a certain weight. I believe it's a little over 80 pounds. And so it's those that are high risk for, that potentially could have severe disease based on their age or underlying health conditions. So this will be a referral base, so there will be a need for a referral to this site by a medical provider. But that's just another means to try to assist in those that could go on to develop really an acute illness.
Mr. Chair, is that a different therapeutic than the blood plasma?
Yes. This is a different process. So what I know is our West Central Coalition, Hospital Coalition, is partnering with a hospital in Fargo to support this, so those in the West Central region in Minnesota residents will be able to go to that site. Now, West Central doesn't believe that the information from the hospital system has been made public yet, so I'm just going to refrain from naming that, but that's supposed to be happening, as I understand it, this week. So hopefully that information will be out there, but and we'll share it as soon as we know that all that information from that health system has been made public. I looked and I didn't see anything yet, but that is coming, and that'll be a good. It will be good for our metro community, because it's not only the North Dakota, but it'll be our West Central. So
would that be something, Kathy, that any medical doctor then could refer somebody to?
Correct. Yes.
So any individual's personal physician would have the ability if he felt they met the criteria to,
Right, that's correct. They'll depend on those referrals, because it's really for those people that are really susceptible to developing a very severe.
and is that something, do we know, is that this type of monoclonal, whatever you said that it was,
Yeah.
is there an adequate supply of that?
You know, I don't have the information on how much we're receiving, and I checked with my contact at West Central, and they don't know the amount yet of what the supplies will be that we're receiving. So they'll be providing more information once they receive that as well. So that's what we know right now. So it's an infusion. You'll be referred from your physician. Any medical provider can refer you. And so more information will be coming up on that. So we'll provide information. As we receive it, it should be out there soon, because my understanding was it was going to be coming this week, the supplies. So,
I have a few more comments or questions, but I'll wait till you're finished with your report.
Sure. Let's see. I think I want to say maybe that is all I had at this time, other than the governor's, message about, and he might have more information coming out on further restrictions because of the rates of infection and the deaths. So in the next 5 to 6 days, I expect, the condition to change rapidly, and so they're really monitoring this, and the governor will make the changes as he determines we need to. I mentioned the holiday guidance, so they're really just saying, be very conscientious about Thanksgiving, and as Christmas is around the corner, we'll have to be very conscientious about that as well. We do have a new, there's a new measure that MDH just put out, and it is the percentage of, it's a risk assessment planning. So it's a percentage of risk percentage that one person in a group of 10 could be COVID positive. And so it's a new measure. We put that out on Facebook and on our website. But it's, if you're attending an event in Clay County, so one person in a group of 10, there's a 46% chance that 1 in 10 would be positive. In Cass County, it's 50%. So they're pretty close, the 50% chance that one person in a group of 10 would be positive. So it's just another risk assessment tool that MDH is looking at. So attending events, and you're in a group of 10.
Is that's different than I've heard that message before. So it's a percentage, 50% that 1 in 10 will have it.
Correct.
So is that the likelihood? Is it also then a 46% chance that if you're in that room, you're going to get it?
Well, they don't go as far as saying that, but
right. But see, that's you hear different messages going on there, and I think you can probably have if you have a room like we are here right now, and we're doing what you've told us to do. I don't have my mask on right now, I'm talking, but we're plenty of distance apart.
Right.
And then at the appropriate time, we do wear our masks when we get up and move around. But so just because you're in a room with 10 people doesn't mean you're going to have a 46% chance of getting COVID.
Right. It's just the 46%.
I'm trying to get rid, lessen
correct.
the fear a little bit here
Yes.
too, but it still is very.
Right. It's just to demonstrate in a gathering the potential of one person in those 10 people being positive. Now again, wearing masks, distancing yourself, plays a part.
And hygiene to make sure you do.
Yes, exactly right. So it's just that if you think about it, if you're in a gathering of 10 and you're in close proximity and maybe people aren't wearing masks, just think about maybe one of those people could be an asymptomatic spreader. Right. It's just another tool to think about. So you're correct. Commissioner Campbell.
Because, you know, I've heard people message that, well, if you're in a room with 10 people, you have a 46% chance of getting
Right,
COVID.
right.
That's not what that,
That is not what this tool is about.
Yeah.
It's just to think about, this is, the community spread is so great that there's just a larger percentage of people, and they may be asymptomatic spreaders. We're seeing a lot of that. So you're asymptomatic, you've been in groups, you're feeling fine, then 2 days later, you're ill. So technically, you have spread that, or could have spread that 2 days prior to you feeling ill, 48 hours prior.
seeing as how you're getting close to wrapping up, I have a question on this chart. And
Yes.
This chart is, the print gets really faded underneath here, so in my aging eyes, I have a hard time reading it, but it talks about total Clay County cases. I would really be interested to see how this chart looks with active cases.
Okay. Sure.
You know, I've been pretty outspoken to what age groups I think are the ones who really are impacting this increase in this virus.
Sure.
I don't think it's any secret into the age groups that are probably the primary area. And this shows it too,
Sure.
you know. But I think we need to draw attention. If you have this group here, that's the highest group, they don't just stay amongst that age group.
Correct.
They go to every other age group in one way or another.
That is correct, yes.
And so that's the point in how we going to educate these people that you can't just freely party with 50 to 100, 150 people. And just because you might not be able to do it in a bar doesn't mean you should do it in house parties or in a park even, you know, with that many people. But
Yes. No, I'd be happy to, I'll have those that are looking at all the data, I'll have them graph out our current cases. So
that would be helpful, and
we sure can do
and
that.
maybe it'll prove me wrong. I don't think it will, but I think Commissioner Haney has got his hand up there.
Jim, did you have something?
Well, we do know, we have,
Kathy, just a minute, can you repeat that question? I don't think I can.
okay, he was asking about the timeline for the vaccine. So when we have our weekly meetings with the Minnesota Department of Health, we believe that the first round of vaccine will be out before the end of this year. And so that's the best they know right now. Those, it will be not a large percentage of doses. So it will be the healthcare workers that receive the first vaccine. Healthcare workers that are both in the hospital setting and in long-term care, caring for people. So they'll receive the first vaccine. We don't know an exact date, but what they're telling us on our last meeting that we had just yesterday, that they anticipate, they won't give us a date, but they anticipate will be out before the end of this year. And there will be a variety of ways that will be distributed. So healthcare systems may get the vaccine. There's a couple of pharmacies, chain pharmacies, that will also have registered as a provider for the vaccine. And of course, in public health, we'll be providing that vaccine as well. So what we know right now is there will be a small dose or small amount of supply of the vaccine. We aren't even sure if it will cover all of our healthcare workers. We're certainly in hopes of that, but we will be getting that hopefully by the end of this year.
Is that the Pfizer?
I'm not sure which brand it's. We do know it's the ultra-cold, but it could be. I didn't hear which group we're going to get it from first, but I do know it's going to be the ultra-cold supply.
Can we fix the sound?
Jim, your microphone isn't working.
No, it's the.
Jim, you know, we got a tough time hearing you. Have you got a mic on, or can you turn it up?
It's up all
The mic needs to
I
be
can hear
in
now.
this. Well, we can.
Could you repeat that again?
Will the people in long-term care facilities be prioritized for the vaccine?
So he was wondering about the people in long-term care facilities will be prioritized. It will be healthcare workers initially, because they're the ones providing the care. So healthcare workers in long-term care facilities will be in that first group. Yes, the second group, once they receive enough doses for all the healthcare workers, the next group will be those that are in the highest need. So those will be residents of long-term care facilities, those that have high-risk conditions, those that are elderly. Those will be in the next grouping. Did that answer your question? Okay.
Can we put a microphone on that laptop, Steve, or something? Like that one there? Because I think the sound's only coming out of the laptop.
Oh, it's 100%.
Okay. Yeah, so.
Right.
Is there?
While we're doing that, Mr. Chairman, I just want to raise a little bit of information here because people at home don't see this and we're talking about it. And Kathy gives just the current weekly numbers in her report here, but in Clay County, as of the week of November 11th, we had 847 active cases. You go back to September 30th and that number was 204. So you can see what's happened here in this last month and a half. It's gone up 4 times. And if that keeps going,
That's right.
it goes to Commissioner Mojo's comments about what in the world, where are we going to put these people when they're really sick?
It's very significant. So when people talk about they're kind of tired of this and tired of the masking and tired of the social distancing, we have to work through this. We're not done with this. There's going to be a light at the end of the tunnel, but we really have to be vigilant because our numbers are, just as you mentioned, they're going up, and that's unfortunate. We're seeing that in multiple places. So the only thing we have right now until we get the vaccine and get it to the general population, which will be a while, we really have to just be vigilant about the social distancing and the masking in public places, and it's a concerning number. There's no doubt that.
I don't
You
think
know,
there's-
and I want to make one more comment to any employers who might be out there. If you have an employee who is calling in and reporting sick, please don't tell them to come to work.
Yeah.
That's exactly right, and we are very clear with all of our case investigations and contact tracing. We're very clear about, if you're positive, you must stay home for 10 days. That's just a given. And if you're still running a fever or your symptoms aren't improving, you're staying home longer than that. And so many employees that we're working with are ensuring that either we send a letter, so public health is sending letters to individuals to tell them when they can go back to school or work. We're providing a lot of those, so workplaces are asking for when are you done with your isolation or when are you done with your quarantine. That's 14 days. That's if you've been a contact. We're also telling them when to get tested. If you need to get tested during your quarantine period, that's the 5 to 7 days after you've been in contact with someone. If you get tested right away, it more likely will be negative, and then it's a false negative. You may get infected in a few more days. So
I think most employers get it, and they're understanding this. I just happened to know this weekend of somebody who had several of the symptoms. He called his employer, and his employer said, "Come to work." And that's just unacceptable.
it is, and when we hear about those businesses, we do reach out.
I'll share one with you.
Okay, that'd be great, because we will reach out to them, and I've received a few calls, and our environmental health specialist has also received calls about businesses, and he will call them and/or make a visit to ensure that they're following.
This particular business isn't in Moorhead or Clay County,
Okay.
but it's in our community.
Okay, so we need to, I know I've heard some on the Cass County side too, so we share that information with officials over there so they can follow up as well.
Yeah, I think the one thing we've noticed there aren't any figures that are going down. They're all going up.
Right.
You know, so there's nothing to say that it's getting better.
No, that is correct.
So you're really not coming with any good news this week, so.
Sorry about that.
Other than the vaccine may be closer.
Therapeutics, I think those are important things. And I had shared on social media this week, you know, I've been on quarantine 2 different times because of close contacts, and it is very difficult for a lot of people trying to manage what loss of income may be, or teaching kids from home. There is a huge strain on the community, but I think it's important for people to know that the more mindful you are right now of your actions and your interactions will help us to keep kids in school. It will help to keep these businesses open. It will help us to move forward. I've heard this long winter thing, you know, we are going into normal flu season anyhow, so folks are getting sicker and maybe not outside as much, but the more we can do, you can do personally to limit your exposure, just helps everybody. You know, and I don't want to be, oh, that's government telling us what to do. It's not. It's just be careful.
Commissioner Mojo, I've seen
Unfortunately, COVID has hit us in this room
It has.
in the worst way. And Kevin is not the only person that has tested positive in this room. Kevin is the only person that has lost somebody very close to his heart. And it's unfair. It takes no prisoners. But he doesn't want to sit here and preach to everybody.
Right.
But it can hit you when you're not even expecting it.
It can. And it can hit
I've
anyone.
seen people who have suffered economically from it. You have a better chance of recovering economically than you do if you died.
Yeah.
And
Yes. It can hit anyone at any time, and even those that take precautions. There's not 100% guarantee that you can prevent it either. I mean, we do the best we can. Masking, social distancing is our means right now, but it is not 100%, but it's the best measures we have before we get that vaccine. So those are what we need to do, and everybody needs to think about all the people they're around.
I think that quarantine period is, it's so tough to understand sometimes. I mean, you may have COVID and you may have high fever, but you get over it, but you still got that quarantine period to wait out, but you feel good. So you think, well, I'm feeling good, I can go out. But you still should, go through your quarantine period. And I think that's where, I mean, I know I went through it. I felt good after a while. I mean, after a few days, I felt okay. But you have to wait out your whole period. It's just till you can go back into the public again.
That's correct, Mr. Chair, because as we've talked about, the 14-day period is when you can become symptomatic. When the 10-day isolation, when you are positive, that's the period of time where your symptoms will resolve, but also the virus lessens, so you become not contagious at that 10-day mark. The 14-day period, we have people that become symptomatic on day 12, so you can then start spreading it. We have people that quarantine for 12 days, they become symptomatic, and so they're positive. They have to go now 10 more days. So it's a long period of time if you think about 12 days of quarantine. Now I'm positive. I have to now be 10 more days isolated.
The tough thing is to understand sometimes, if you're in the same household, one gets it and one doesn't get it, you know. how does that work out, you know? It's just, your immune system more than likely is different, but,
That's right, and how conscientious you are. There's a lot of variables in your own household, because obviously if you have young children, the parents can't stay away from their children, so they have to take care of those kids. But it's being conscientious about wearing your mask, trying not to, if you're adults, you know, and one is positive and one is not, you're not gonna sit and watch television together. You know, you really need, we tell the positive case, if you can go to another bedroom and stay isolated, don't be in the kitchen at the same time, don't be in the living room at the same time. You really do try to keep separated to avoid passing it on to the other individual in your home or other individuals. So, you know, you do the best you can depending on your situation in your home.
okay.
Other questions?
Okay, thank you for the update again, and
Yes, thank you.
very enlightening and concerning.